Oral health is a really big part of your overall general health. I've got Dr. Cesar Swide on here with Gulf Coast Periodontics and Implants in Gulfport. Tell us a little bit about what you do.
Well, thank you for having us. We are a specialty dental practice in periodontal disease and dental implant care. So periodontal disease is a very common disease that affects more than half of the population over the age of 60. We specialize in keeping the surrounding tissue around dental implants and around teeth healthy. The bone, the gums, the roots of the teeth. So think about us as the foundation of your teeth.
So I guess a good part of the issue I think some people have is what's happening below the gum line.
Correct.
And you can't see that. You can feel it, but you can't see it. So you don't know. What do you say to those folks who are beginning to feel that pain that is a little bit abnormal?
Okay, so one of actually the good things about periodontal disease, it is that it's a painless disease. But unfortunately, it's also the worst thing about periodontal disease.
Right.
Pain serves a function in the human body. It kind of tells you that there is some sort of tissue trauma or tissue injury that is happening. So the struggle with periodontal disease, it's one of those things that somebody has to check for, kind of like high blood pressure and diabetes. You know, these silent kind of chronic diseases that are familial, basically they're run in families. And a lot of it depends on the genetics of the person. So it is very important to keep track of your dental health by visiting your general dentist and visiting your hygienist so they can identify any kind of problems and address it pretty early on.
So what are we doing that is causing this? Is there some triggering behaviors that we can eliminate and to help stay away from periodontal disease?
So the best treatment is kind of preventative treatment, right? You doing your home care at home, brushing twice a day, flossing. Mouthwash helps to some degree, but mechanical debridement is probably the best approach, and keeping your dental visits. I can't stress that enough.
Well, okay, so so preventative, I guess that feels like what we should all be doing anyway.
Correct.
Are there things that we should stay away from? Because I know when you go to the dentist, they're like, well, stay away from like really hard, sticky candies and things like that. Are there things that are worse for us than others?
A lot of it is genetic, to be honest with you. 80% of the progression of the disease depends on how your immune system responds to that bacteria that is kind of, in general, all over the place. Like, sure. There's more bacterial cells than human cells in the mouth, unfortunately. Right.
That's what we hear. I hear that the human mouth is like the dirtiest place in the world. It's pretty bad.
It is not very hygienic, yes.
So what are some of the benefits of the technologies that you use here with your patients?
So we use state-of-the-art dental technology. We have a state-of-the-art dental laser that we use to treat periodontal disease, although we still do conventional approaches. We also have a digital workflow to help people who are completely edentulous, meaning without any teeth, or headed that way, that we can use digital scanning, facial scannings, photogrammetry procedures, which is basically capturing a 3D reconstruction of your teeth and your face. And we can help people who are transitioning from a set of teeth into a full set of implants, and we can do that in probably 3 to 4 hours, where we can 3D print a temporary set of teeth that goes in and is fixed in place without having to go without any teeth for any given period of time.
That's huge, a 3D printed set of teeth. So I know that, whenever, for example, when you have to get a crown, you have to get the base workup happening, and then they mold it, and then they send it off, and you got to get a temporary. So all that stuff you can do here in the office.
Correct.
Wow.
So yeah, a lot of it is digital workflow. The technology is amazing. Now, not everybody's a good candidate. Obviously, we want patients to keep their teeth for the rest of their lives.
Sure.
But sometimes, it's a little too late because nobody checked for periodontal disease, which is the most common reason for people losing their teeth is periodontal disease.
Well, and I mean, it goes without saying, but your teeth and your smile goes a long way in also keeping your mental health in check as well.
Correct. Missing teeth is a disability, right? And nothing shows a happy person more than a smile, right? So you have to be confident with your smile. We've had a lot of patients over the years that were like either embarrassed of their smiles or thought they were helpless,
sure.
And then you give them a treatment option that would help replace all that. It's an amazing thing.
It sounds like you here at this office, you employ a good bit of technology, some of which I didn't even know existed in this field. Would you say that is one of the things that kind of sets you apart from all of the other locations?
Correct,
here?
but the thing that sets us apart the most is how we take care of our patients. We care about them. Some of them, I mean, I'm carrying on from previous periodontists that were in this office, and this practice has been, running around for over 40 years.
Oh, wow.
So, and some of these patients have been there for more than 40 years. So it is kind of what sets us apart, is how we care about our patients.
Well, I will say I just saw my mom leave here, and she's pretty picky. Like, she's pretty picky as a general rule. So the fact that she's coming here tells me a lot about your practice.
She's a wonderful lady.
So let's talk about that technology. You mentioned using a laser. Is that something that you can use? My daughter had to have a lip and a tongue tie addressed, and they her dentist used a laser. And then there was my 9-year-old had to have some, like, not full-on cavities, but had to have some work done. They used a laser. Is this the same kind of laser?
So there are many different kinds of lasers depending on which crystal they're using. So it sends off different wavelengths, so it can achieve different kind of procedure. It all depends on which part of the body is actually absorbing that kind of energy. So we use a laser specific for periodontal disease. It can do some frenectomies, kind of like what you had, the tongue tie, but mainly it kills the periodontal disease-causing bacteria.
Is it less invasive, I guess, than what you would normally use?
It is definitely less invasive than conventional surgical approach.
That was the reason I asked, because it was this situation where there's some light, like, decay, not necessarily fillings, but she didn't have to have any, like, shots. She could have some work done up top and then go to the bottom. So it's nice to know that I can't stand a shot. If I can stay away from a shot, I would rather stay away from a shot. But is this one of those things where you don't have to have as much?
We usually, for laser, for this kind of laser procedure, it is a comprehensive laser approach.
Sure.
So those surgeries usually take a couple of hours on average. And we use conscious sedation, so the patients are kind of in a sleep mode. They don't remember anything.
As the way it should be.
As it should be. Dentistry should not be uncomfortable.
There you go. What do you say to those folks who are watching right now that are thinking maybe they want to come and have a consultation, but they're really nervous about it?
So the main thing is to initially find out if you need a periodontist, right? That's where we count on your general dentist. We work with almost everybody on the coast. So keep your dental visits on track. Consult with your general dentist and your hygienist and see if there is anything that would dictate that you need a periodontist. Need of dental implants, need of soft tissue grafting, need of periodontal care, and then they'll decide if you need to see a specialist. And we kind of keep everybody as comfortable as possible. Again, sedation we do a lot of conscious sedations where everybody's comfortable and they don't have to stress out about dentistry.
Absolutely. Well, see, there you have it. Listen, if you have questions, if there's some pain, if something's uncomfortable, give Dr. Swida and his team a call here and they will get you taken care of. Thank you so much for being with us.
Thank you. Appreciate it.